Sometimes the breast cancer cells can be disseminated or scattered throughout the breast, and in order to remove all the cancer adequately, the surgeon will recommend a mastectomy, as opposed to if there's a small but solid lump, which can be removed adequately just by removing the lump and a small amount of tissue. DCIS stands for ductal carcinoma in situ, and this is where the breast cancer cells are all contained within the breast duct and haven't spread outside to the surrounding tissue or to the lymph nodes. There's usually no palpable lump, and this is often only diagnosed by mammogram. The treatment for this kind of breast cancer is usually surgery, sometimes followed by radiotherapy, but it doesn't usually need any further treatment like chemotherapy. An invasive cancer is where the breast cancer cells have invaded the tissue outside of the breast ducts. This can be a small area of tissue that hasn't spread to the lymph nodes at all, or it can be a larger area of tissue where there is some spread to the lymph nodes. But these details alone don't indicate that there's any spread to the rest of the body. They just indicate the nature of the cancer within the breast and the underarm. Research has shown that a wide local excision or a lumpectomy, plus removal of some of the lymph nodes and some radiotherapy treatment afterwards, is as effective as having a mastectomy in certain cancers. Research has shown that ladies who take HRT for 10 years or more may be at an increased risk of developing breast cancer, but there's no evidence that there's a direct cause. Immediately after your mastectomy, you'll be given some soft padding to put inside your bra, and then at a later date the breast care nurses will get in touch with you and arrange an appointment to have a more natural looking prosthesis fitted. These usually last for 3 to 4 years, and when you need them replaced you can contact your breast care nurses and they'll arrange that for you. Radiotherapy to the breast or underarm doesn't cause your hair to fall out. Hair loss in breast cancer treatment is usually due to certain drugs that are added to a chemotherapy regime. This is most likely because your breast cancer is what we call estrogen receptor negative, which means that the breast cancer cells weren't using the estrogen in your body to aid their growth, and so you wouldn't benefit from these tablets which inhibit this action. It's sometimes possible to do an immediate reconstruction at the same time as the mastectomy, particularly in a cancer that's very early stage and doesn't need chemotherapy or radiotherapy treatment afterwards. But if you have been recommended these treatments, then many surgeons prefer to delay the reconstruction until after the breast cancer treatments have been completed. This reduces potential complications with the reconstruction. Following surgery to the breast and underarm and radiotherapy, you can sometimes get some congestion of the lymphatic system, which helps to drain excess fluid from the tissues. This only affects about 25% of ladies, and there are lots of things that you can do to help prevent this happening. The Breast Cancer Haven have produced a DVD which explains all the preventative measures that you can take. It's not unusual at all to feel like this, and it's often when the body is healed physically that all the emotional and psychological healing takes place. And most people need just as much support with this as they do through the physical treatment. If you're unable to get face-to-face support, you can access support via the internet or by telephone through Breast Cancer Haven.